Beck, I'm a dental assistant at L&L Orthodontics. This video is going to be demonstrating how to take care of your braces after the initial bonding. Within the first few days, you could experience one of your brackets come off. This is completely normal. It just means whilst you're trying to set all of your brackets, there could have been a little bit of moisture or saliva underneath the setting glue, which has caused the bracket not to bond properly. If this does happen, please don't hesitate to give us a call and we can organise an emergency appointment for you to come in and have this bracket rebonded. That's throughout your whole treatment. If a bracket comes off, just let a guardian or a parent know and they'll be able to give us a call. Within the first couple of days to a week, you could experience a little bit of pain and tenderness or the braces rubbing up against your cheek. If this does happen, you can take some Panadol or Nurofen to help ease your discomfort. And if any ulcers appear, having some warm saltwater rinses will help the healing process as well. What I am now going to go through with you is the foods we'd like you to avoid whilst you have your braces on. These are your stickier foods, so things like your toffee lollies, your minties, chewing gums, red skins, anything that really gets stuck to your teeth will get stuck around the braces and break them off. We just ask that you avoid those types of food. The foods we would like you to modify how you eat are the things that you bite on from the front, so things like your apples, your cucumbers, your carrots, anything kind of hard from the front. We would just like you to cut them up into smaller pieces and use your back molar teeth to bite on them, as the braces back there are a lot more stronger than your front ones. Now what I'm going to show you is how you're going to keep your teeth clean with your braces. The first step is making sure you're doing the correct brushing routine. So over morning, it's going to be quite simple. You will just be brushing your teeth. Over nighttime, there's a couple extra steps that we're going to add in, and I'm going to demonstrate how you're actually going to brush properly around these braces. First of all, over nighttime, you're going to want to floss your teeth to get all the dirty food and bacteria out from underneath your gums. We suggest using Oral-B Super Floss. It's really easy to get underneath the braces and the wire in order to floss your teeth. So, the floss comes with a pointy threader as well as a fluffy piece of floss and a normal piece of floss, completely to your preference which one you'd like to use. And the way it works, you're going to get as far back as you can with your braces and you're going to get the threader pointing downwards and you're going to go underneath the wire and then you're going to thread it through, and you're then going to be able to floss through those two contact points as per usual. Then you're going to pull the floss out and go to the next tooth and do the same thing. So it can take a little bit of time, but once you get used to it, it does get quite easy. After you have flossed your teeth, you're then going to want to brush your teeth. So whether you use a manual or an electric toothbrush, I'm going to show you both ways that you can do this. So if it's a manual toothbrush, you're going to want to get the toothbrush on a 45-degree angle downwards, and you're going to start from one side and you're going to do soft circular motions, making sure you're getting the top part of the gum as well as the top part of the tooth surface and meeting up in the middle. Then you're going to rotate your toothbrush and come back this way as well, meeting up in the middle. Always ensure that you're meeting up in the middle so as you're getting every tooth surface. Once you've done that, you are then going to go straight on top of the braces and the wire and ensure you're giving them a good clean. So make sure you're doing soft circular motions all the way around. After you've done that step, you're then going to do a 45-degree angle upwards and do the same thing, always meeting up in the middle. The way I like to see it is you're doing a C around the braces. These areas here, you're just going to brush as per normal because there's no braces in the way of that. With your electric toothbrush, it's a little bit different because your electric toothbrush is automatically doing the motions for you. So instead of doing the circular motions like you would with your manual toothbrush, you're just going to hold the electric toothbrush in the same spot for about 3 seconds and move forward. So it'll be 3 seconds going around like so. That is how you're going to brush your teeth over nighttime. Once you've finished brushing your teeth, we'd like you to use tooth mousse. This tooth mousse is really good to get the calcium and minerals back into your teeth, and it helps fight against any cavities. You're going to pop a pea-sized amount on your finger and use your finger to rub it all across your teeth. Once you have done that, you're going to leave it in your mouth for 2 or 3 minutes, letting your tongue swish it all across your teeth. Your saliva is what activates the main ingredient in the tooth mousse. Once you have left it in your mouth for 2 or 3 minutes, we ask that you spit it into your sink and go straight to bed. Don't rinse out any of the tooth mousse that was left on your teeth because it's going to do the most whilst you are sleeping. Now we understand you don't brush your teeth whilst you're at school, but we're going to give you some alternatives to help make sure your teeth stay clean whilst you are at school after eating snack and lunch. Once you're finished eating snack and lunch, or if you're out in public and you've had some food, please give your mouth a really good rinse with some water If you feel that there is still food stuck in between your teeth, we're going to give you plenty of what are called pixters. They're little Christmas tree brushes, and the way that they work, they bend, and what you're going to do if you have any food stuck in between your teeth, these work really well to help push any food particles out. You're going to want to remember to always go down and away from your top arch, never up and towards the gum line, as that can cause irritation. It's the same with your lower teeth. When you're cleaning your lower teeth, you're going to be going up and away from the gum line. Once you've finished getting all the food out, you can give this little brush a rinse under with some cold running water, pop the cap on and reuse as necessary. Once it starts to get old, you're more than welcome to throw it out and grab a new one. Each time you come into the practice, we're more than happy to give you some more pixters to take home with you. In your goodie bag, you will also be receiving what's called orthodontic wax. This is going to be very beneficial if there are any areas that are causing any discomfort to you once you start your braces treatment. If there's a bracket that's irritating you, or over time, once the wire starts to straighten out, it's got nowhere to go except to the very backs of your cheeks, and it can cause what is called a pokey wire. Now, you can use orthodontic wax as a temporary fix, but if the wire is causing you too much discomfort, please let your guardian or parent know, and they'll be able to give us a call and we can organise an emergency appointment for you to have the wire trimmed. I'm going to demonstrate now how you're going to use the orthodontic wax. Now, it comes in a little clear container and it comes in all these wax strips. All you're going to do is peel off part of the wax, and whichever area that's irritating you, you're going to roll the wax up into a warm bowl, and you're going to dry the tooth that's affected. So if it's one of the front teeth over here, you're just going to use some paper towel or tissue and dry it first before placing the wax. If it's the very back where it's a pokey wire, you're going to try and do the same thing. The wax sticks best to a dry area. Then once you've rolled it up into a warm bowl, you're going to place the wax over the top of the irritated bracket. You want to make sure that you're not pushing the wax down too far that it pierces through. You want to make sure there's a layer over the bracket so as it helps relieve some of your discomfort. Now, you are able to eat and drink with the wax in place. If it does come off, that's completely fine. You just reapply it as much as necessary. I would just like to congratulate you on starting your light force journey with us here at L&L Orthodontics. We look forward to seeing you at your next appointment with us.